everybody. It's so nice to see you, and I'm so delighted to be here. Thank you for hanging in there and staying with us as we close out the day and the conference. So I know some of you, but we are Hilarity for Charity, and I'm so excited to tell you about our innovative and transformative approach to Alzheimer's and dementia care, as well as brain health education. As you know, our celebrity founders are Lauren Miller Rogen and Seth Rogen. We like to think of ourselves as a warm place for serious business, and they certainly have set the tone for that. They've been doing this work in the space since 2012, and they have been, not only have they been throwing larger than life events, variety shows, but they have been fierce and passionate advocates in the space. You might all think, like, what is it like? What is Seth Rogen really like? And I will say they're both warriors, and they have, they're very involved in what we do day to day. They speak on panels for us. They spoke here at SLIF in Napa back in 2022, I think. They create a lot of content for us. They're creative genius behind all the events. And so they are very involved in our mission. They did this work in honor of Lauren Miller Rogen's mom, Adele, who was diagnosed with early onset Alzheimer's at the age of 55. Lauren and Seth had just started dating. They were in their 20s, and they were faced with this very, very, very challenging situation. And I love this quote. This shows the family. Lauren and her brother, Dan, are both involved in the organization, and they say at the end, our mom would be proud. And I really, as a mom myself, I know Adele would be very proud of the work that they're doing and that they continue to do. So they really do walk the walk as well. Here's a little video to show you, give you an introduction of the organization.
Alzheimer's is a pretty dark disease, so we like to think of HFC as a place to find some light in that darkness.
My fellow professors and I have teamed up to present you with HFC Universe.
It's not often that you see young people in the Alzheimer's space, and I was just very empowered by that.
Knowing that I've got these people around me that understand has just been really valuable.
You should not have to be a movie star to be able to care for a family member with Alzheimer's.
I didn't know about Alzheimer's. HFC changed my life.
HFC offers this unique space where we can learn from each other about caregiving and about brain health, but we could also support each other through hard times.
Amazing. So before I get into brain health and some of the work we're doing in supporting caregivers, thought I would just frame the epidemic for you. I'm sure this is not new to some of you, but we know that Alzheimer's and dementia is a growing epidemic. From the years 2000 to 2019, deaths by Alzheimer's and dementia grew by 145%, while other top 10 causes of death either stayed stagnant or declined. 1 in 9 people over the age of 65 have Alzheimer's or dementia. If we look at that stat for people over 85, it's 1 in 2. Across the country, there's about 6.5 or 7 million people with Alzheimer's or dementia, and those are the ones that are diagnosed, not including everybody walking around asymptomatically. This disease disproportionately impacts some communities more so than others. African Americans are 2 times as likely to have an Alzheimer's diagnosis. The Latina population is 1.5 times as likely. And by 2030, nearly 40% of people living with Alzheimer's will be Black or Latino. And we know that people of color are less likely to receive a diagnosis. They're more likely to experience discrimination in their patient or caregiver journey, and they are less likely to be enrolled in clinical trials, which has been a huge issue. And also the disease disproportionately affects women. And it's a growing national crisis. I know you all are experiencing increased costs in caring for people with memory issues, and you have increased staff turnover and burnout. But by 2050, this disease is expected to cost the country $1.1 trillion if there aren't any major changes in therapies and care. And only about 64% is covered by Medicare or Medicaid. But there's hope. And I've been certainly so impressed with all of what we've been hearing this week in terms of AI supports, but there are also disease-modifying therapies now available. You know them as Leqembi and Kisunla. At the CTAD conference last week, they're talking about combining therapies with these disease-modifying therapies. So there's a lot happening. There's auditory tests, eye scans, blood-based biomarkers, other auditory biomarkers as well. So we are very excited about things happening in the space. And it's definitely changed in the 6 years that I've been doing this work. Nobody was talking about prevention 6 years ago. That was just a term that wasn't really used. And so now we hope we're contributing to people talking about their brain health as well. So we're just going to do a little true and false quiz here. So please indulge me. Alzheimer's is an aging disease. It's just an inevitable part of growing old. All right, there you go. No, it is not a necessary part of aging. And one of our science advisors, Dr. Annie Fenn, says prevention is definitely a cure. Alzheimer's disease begins to form 20 to 30 years before the onset of symptoms. That is true. So the time for Lauren's mom to have started thinking about her own brain health would have been in her 20s. And I can tell you, Lauren and Seth very much are on a brain health journey, and they do so much to prevent the disease. 45% of Alzheimer's cases may be delayed or prevented. True. I think somebody said 40. It's 45 now from the latest Lancet Commission, yes, report. And lastly, there's nothing I can do to reduce my risk of Alzheimer's. False. That's right. It's never too early and it's never too late to start employing brain healthy lifestyles. So I'm just going to share a little bit about the brain health work and that we do at Hilarity for Charity. So I want to start by saying that our work is really rooted in evidence-based research. And so we partnered in 2017 with New York Presbyterian Weill Cornell, where we tested the notion that people can learn about their brain health. And it was the first time that a study was published in neurology about education and Alzheimer's prevention. And so here's what we proved: that youth learn better from celebrities than from doctors. All right, well, that's some youth learn better from celebrities. I can't remember if it was high schoolers or college students, but one of those groups preferred learning this information from celebrities. And so that really was the impetus for us creating HFC Universe, which is our umbrella platform around brain health, education, prevention, and all of our youth-based work. You can see the three topics that we really are under this umbrella is we have an online learning digital platform called HFC Universe, or you can find it at maintainmybrain.com. We have brain health leadership training, and that is training students to become peer educators across the country. And then we have the Youth Movement Against Alzheimer's, which is a college and high school chapter network across the country. And so I'm going to give you a little introduction, video introduction to our digital coursework.
Hi, I'm Kristen Bell here in HFC Universe.
Hey guys, I'm Maitreyi Ramakrishnan.
Hey guys, it's Chloe Kim.
I'm Quinta Brunson.
I'm Seth Rogen.
Guys, Alzheimer's is not the old person disease you think it is.
Did you know that Alzheimer's can begin in the brain 20 to 30 years before the onset of symptoms? That means the time for young people to take care of our brains is now.
Like now. Young people have a unique power and perspective to change how the world thinks about brain health and ultimately change the course of Alzheimer's disease.
My fellow professors and I have teamed up to present you with HFC Universe, a school for your mind. Okay, every school is for your mind, but this one physically helps your brain.
Hello!
Do you want to hear a fun fact?
I have a feeling you're going to tell me either way.
I certainly am.
Your brain will thank you.
Thank you.
I'm so glad you're here at HFC Universe to stay fit physically and mentally with me and my fellow professors who want you to remember one thing.
It's never too early to start taking care of your brain.
Get ready. Class is in session.
So you saw our new faculty. So the original coursework was taught by Seth. We developed 5 new courses that go deeper into each of the brain health habits, and we were so excited to recruit new celebrity professors to help us expand the appeal of the program. To date, when we relaunched this year with our new coursework, we were able to garner over 4,000 student learners. We've trained over 75 brain health peer educators. On the platform, there are 28 courses, and they're not just for high school and college students. You can be anybody's student of life. There are 19 master classes taught by Dr. Richard Isaacson, who is a nationally recognized prevention expert. And we have an Instagram account for HFC Universe. There you go. And so yes, 4 in 10 cases can be prevented. We've heard that. And so how do we do it, right? So there are things we cannot control. We can't control our age. We can't control our genetics or our family history. But certainly these are the things at the top of the chart here that you can control. And it's also important to control some of the health conditions such as hypertension, high cholesterol, and obesity. We don't want you to smoke. We want your mental health to be in check. And I'm sorry to say, but we have to really limit our alcohol intake. Probably good to tell you that after the white party. And here is what HFC focuses on, our 5 brain health habits. Sleep. Sleep is totally a free thing you can do to start taking care of your brain right now. So here are just a few tips. Just, have a routine, keep your bedroom cool, get the morning sun, and track your sleep. I have been so afraid to track my sleep, and I finally got a Garmin watch. I'm tracking my sleep, and it really is makes me feel a lot better about my brain health, to be perfectly honest. And you can track, if I eat sugar at night, I don't get as much deep sleep. That's just how it goes. Or a glass of wine, same thing. But if you do have a glass of wine, have it earlier in the evening, not right before you go to bed. Nutrition. None of this is going to surprise you. Everything that's good for your heart is good for your brain. Lots of green leafy vegetables, whole fruits, whole grains, etc. And avoid high saturated fat foods, processed sugars, processed foods. We all know that it's so important to take care of our emotional well-being, managing stress, meditating, getting outside, and being social. I was so happy to see all of those VR tools to help increase the social engagement for older adults. That's going to be a game changer. And physical exercise, it's about moving your body. I think the AMA recommends 150 minutes. Really, you need more. High intensity interval training is what's recommended, and mixing that in with resistance training. But really get your body moving, improve your heart rate, and stick to it. Finally, cognitive fitness. Thing about that is learning something new. Lauren and Seth, they've taken up pottery. You may have seen some of their beautiful, Seth on his Instagram posts his pottery. They learned how to make pottery. They're learning how to make glazes. And so we say, learn something new, challenge your brain, learn a new language, a new skill. Our youth movement is a chapter network of high school and college students. We've grown this program. We're relying on youth to, help change the course of this disease. We have 60 chapters, over 1,000 students across 24 states. And you might think that, I put this slide up here because I always thought when we started working with youth so, hands-on, it was like, do students really care or want to learn about their brain health? And actually they do. So when we survey them, 83% say after learning about their brain health, they are more motivated to take actions to improve their brain health. 61% would consider early screening. This is huge in terms of reducing the stigma around this disease. 91% want to share their knowledge, and 56% are rethinking their perceptions around people with Alzheimer's. 30 days outside of the peer-to-peer training, we are seeing students report an increased use of brain health strategies across the 5 pillars of brain health. And this stat is higher than other stats that we're seeing in behavior modification efforts, programs such as smoking cessation. So we were really encouraged by this. And I'm happy now to tell you a little bit about our care and support programs, which are really at the core of why HFC was founded. Lauren and Seth very vocally say they were so lucky to be able to provide care for their mom. They kept their mom in home and provided round-the-clock in-home care support, and Lauren understood very clearly that everybody couldn't afford to do that. And so what Hilarity for Charity does is provide in-home care to relieve the family caregiver. We have support groups. In the video you saw, since inception, we've awarded 427,000 hours of care. That's a crazy number. This year alone, it's 30,000, supporting 210 families in respite care. We have 40 ongoing support groups all week long with about 500 participants. And we listened to our communities, and we were hearing that personalized services were very, very important. So we've piloted care navigation and financial coaching. All of these programs are free. And so I just want to say to senior living communities, you know, our programs are free for your residents. So we're happy to partner with you to promote them. And this is another one that might be particularly useful for you is community lounges. I like to say they're a cross between a webinar and a support group. We run 4 to 6 a month. They're virtual, they drop in, and they cover a variety of topics, including self-care for the caregiver, self-care for the caregiver, or ways for the care partner to help care for their loved one. We also have launched our Caregiver Road Trip. This is a digital interactive guide that helps caregivers at all points of their Alzheimer's journey. We've had about 1,400 people visit the Caregiver Road Trip. I think that's an old number. There's probably more now. But what's most important is that people are spending about 13 minutes going through this digital guide, which is much higher than the industry average of other caregiver tools of about 2 minutes. And so I'll play one more video for you all to introduce you to this.
Hello there, caring person.
Welcome aboard HFC's Caregiver Road Trip.
This is not a typical road trip.
Let's be honest, you probably didn't even mean to take it. You're not entirely sure where you're headed, and you have no idea how long it's going to take.
We hope this guide helps you move from what the is happening to an adventurous outlook on all this trip can be.
One way the dementia journey is true to a typical road trip is that there is no one route.
Consider each section an on-ramp. You don't have to take every exit.
You don't even have to start from the beginning. The key is to have a plan, mostly.
While also learning to stay in the moment and take the journey day by day.
This guide is designed specifically for care partners under 50, but age is just a number, right? So hop in no matter how old you are.
There's plenty along the way that's relevant to just anyone who cares.
And again, happy to have you all promote that to your families. Just wanted to share a little bit about the impact, and I just put these slides up here because I know that professional caregivers are experiencing the same kind of challenges that at-home caregivers are. There's there's a lot of stress around it. So just wanted to share with you that some respite is helpful to our caregivers in our network. 93% says it helps them manage the stress with caregiving. They use the time to attend to their own financial needs. They practice self-care. They use the time for social engagement, taking care of their personal daily activities and spending time with family and children. Support groups, also incredibly helpful, improves their well-being, helps them maintain a positive outlook on caregiving, that's huge, as well as having them feel more emotionally and physically prepared for the caregiving journey. So I'll just finish by saying there are ways for us to partner together. We create a lot of content, and we want help in getting it out there. So the first program, and I think there's some postcards on your table, is we've introduced the Executive Circle membership specifically for this community, which gives us another opportunity to convene you all in virtual roundtables. And there are other benefits, including organizational updates, as well as recognition and some tickets to events. I'm happy to talk to you about that. These are our inaugural Executive Circle members. If any of you are here in the room, thank you, thank you, thank you. Been really wonderful. This is our second way to partner. Lauren and Seth have produced a documentary film about their family's journey called Taking Care. We did just show it at the NIC conference, and Lauren spoke at the Women's Networking Breakfast there. This film chronicles their journey with Adele, and it has been shown at a couple of festivals and is going to be publicly released at the end of December, or beginning of December. It'll be available on Amazon Prime, Google Play, Apple Plus. But we're also doing an impact campaign where we're encouraging community screenings of the film because we want as many people to see it as possible. So schools and corporations are already signed up, conferences, but senior living communities have also expressed interest in hosting. So if that's of interest to you, there's a QR code. You can sign up for an interest form and we'll help you set up a screening for your community. You could do it in person or virtually, whatever works. And there is an educational discussion guide that goes along with it to help you have a post-screening discussion. I've screened the film a lot of times, and it is absolutely like a support group. Honestly, at the end, people want to share their story and talk about it. And then the last thing, I'll just invite you to join us for CareCon 2025. This is an annual virtual program that we do that empowers and celebrates caregivers. It's celebrity workshops and expert-led panels, and we have a number of opportunities. We have a Scotty Caregiver Award for an at-home caregiver, but also for a professional caregiver. So if you have caregivers in your communities that you want to throw in for consideration, we'd love that, and there are obviously sponsorship opportunities as well. So thank you for giving me the time and inviting us here, and Michael, thank you so much.
Thank you so much, Bonnie.